Hello and welcome to Measuring and Increasing Hope in Teens to Live Hope-Centered Lives. My name is Julie Marchbanks from Public Strategies, and I will be the host for this session. At this time, I would like to welcome our moderator, Marianne Mozak, President and CEO with Ascend.
Thank you, Julie, and hello, everyone. Welcome to the third day of the training. It's certainly my pleasure and honor to introduce Dr. Hellman for his final presentation. And giving a really an adequate summary for all this amazing information is really very challenging, and it might even be impossible. But if you have been with us for the last 2 days, you will know that he has helped us to define hope as much more than wishful thinking by unpacking the scientific tenets of hope. And importantly, he has also encouraged us by sharing that hope is very much an organizing framework for SRA education. Yesterday, he shared how trauma robs youth of their ability to hope. And ironically, then he gave us hope by showing us that hope is a mindset, a way of thinking that can actually be taught. And then finally, I think a very profound thought that he developed was that hope is a social gift that happens in relationship and in the context of conversation. So we are going to now continue that conversation with Dr. Hellman, and he is going to share with us how to measure hope. So who knew? With that, I will say welcome again, and thank you for all you've shared thus far. Dr. Hellman.
Well, thank you, Marianne, and thank you all for joining again to listen to a little bit more information about the science and power of hope. I will tell you that over the last year, I was fortunate enough to be on a year-long sabbatical from the University of Oklahoma, exclusively focused on what does it mean to be hope-centered. In particular, I was focused on what is the framework for the hope-centered organization program. So I'm going to integrate some of that information throughout this conversation. And so again, I'm going to ask you to use, just like the previous couple of days, to use the chat function a few times, probably not as much as I've done the first couple of days, but please feel free to use the chat function, and I'll certainly leave time for some Q&A, same as we have for the past couple of days. So obviously, the focus on this will be on measurement, as well as what does it mean to become hope-centered. I did pay specific attention to this idea of thinking about being hope-centered in the context of your programs. As you remember, on the first day, one of the challenges that I offered was to really think about your programs as pathways of hope for the youth and families and other stakeholders that you work with. And so within that context, I want to give just a little bit more information about how to put some of that into practice. And so I'll start with the measurement piece, and it is always really interesting to me that I get this question in almost every workshop, in almost every presentation or training that I do. Is, you know, at some point somebody will really question whether or not that I can actually measure hope. And just a little bit about me, I'm a very competitive person. And so when you tell me that I can't do something, I tend to respond to that. But also, as you might remember, my specific training is I'm a quantitative psychologist. And I specifically measure or focused on measurement issues. I firmly believe that I can measure anything. And so we have to remember that hope is grounded in this robust foundation of science. And as a result of that, measurement becomes the heart and soul of science. Now, as I'm going to share with you in just a little bit the way in which we measure hope with youth, and talk a little bit more about that instrument. It was ultimately developed by Professor Rick Snyder out of the University of Kansas. And Professor Snyder, who passed away in 2006, developed the early conceptual framework for hope, goals, pathways, and willpower. But more importantly, he highlighted the distinction between hope and similar ideas such as optimism and self-efficacy. So optimism is this future expectation, which hope certainly has, but hope goes further. Hope is based upon setting specific goals, identifying the pathways, and generating the willpower. So it goes beyond that idea of optimism. Self-efficacy is the confidence that you have that you can pursue those goals. And this is very much part of the willpower component of hope. But again, it's the pathways piece that really distinguishes this idea of hope. The other thing that I would highlight is that hope is really developed from a strength-based perspective. That is, we're talking about hope rather than the reduction of hopelessness. Remember that when I first started the conversation a couple of days ago, I was so focused because of my training on these questions of what's wrong with you, this deficit-based model of well-being, which is the way we've typically looked at hopelessness. So just as a framework, we are focused on a strengths-based perspective. There are multiple scales. The two that I use are available to the public. They're free to use. If you Google both of these names, titles, Adult Hope Scale and Children's Hope Scale, you should be able to find them pretty easily. So they are in fair use. The Adult Hope Scale, which I won't spend much time on, is basically a self-report measure. It takes about 10 minutes to administer and score. The Children's Hope Scale, very similar. It is a self-report measure, and again, takes about 10 minutes to administer. So this is the Children's Hope Scale. And so you can see that it is based upon 6 items, self-report items. I think I'm doing pretty well is the first question. You can see that it has a 6-point Likert type response format. So the way that we score these items is the odd number items actually measure the willpower piece, and the even number items actually represent the pathways piece. So we generate an agency score, a pathway score, add those two together, and ultimately get a child's hope scale. So this is the way we score it. So if you add those scores together, and so those scores can range from a low of a 6 to a high of a 36. And so to help us interpret these scores, our team has developed this grouping mechanism for low, slight, moderate, and high hope. So you can see that children who score between 6 and 12 are classified into the lower hope group. Those who score 13 to 23 represent the slight hope. 24 to 29 represents moderate hope. And scores between 30 and 36 identify the high hope category. The reason that it's been very important for us to use or think about these categories is because when we measure change, so for instance, if you administer this scale as part of an intake for your program, that is, as individuals begin to engage in your program services, you could administer this. And what we're looking for is the change in these scores across time, almost a pre-test, post-test, as an example. And so a program that I just evaluated a few weeks ago, for instance, working with children and youth, what we saw was after 3 sessions, 88% of the low hope group saw an increase in scores. 75% of the slight hope group saw an improvement. 17% of the moderate hope group saw an increase. And then less than 7% of the high hope group actually declined or their scores decreased a little bit. But it allows us to help communicate and understand where that level of impact is actually taking place. In particular, the low and the slight hope group is really where we want to move the needle. Remember, the good news is that hope is something that can be taught. It is something that we can influence with intention. And that was some of the discussion yesterday. Now, I will tell you that when I first started using the Children's Hope Scale and looking at Snyder's original work, the Children's Hope Scale is validated for children ages 7 to 17. And there are language translations, in particular, Spanish language translations that are available. And so the first day that we were together, I talked a little bit about my 12-year-old granddaughter that I take to college campuses as part of that Imagination is the Instrument of Hope. And what I would tell you is that when I first learned that the Children's Hope Scale was validated for children ages 7 to 17, at about that time, my granddaughter, who is quite brilliant and takes after her grandmother, that I was really skeptical of this idea that a 7-year-old could actually respond to this survey. And I'll go back to the survey. And in particular, I was a little bit skeptical that a 7-year-old, for instance, could distinguish between a score of 4 a lot of the time, and 5 most of the time, and even 6 all of the time. That is, that a 7-year-old can understand the distinction between these sort of granular ideas of a lot of the time and most of the time. Because quite frankly, I'm not sure that I always understand the difference between those categories. So as part of our research program, I conducted what is referred to as a meta-analysis. That is, we gathered as many of these published studies as we could find that have used the Children's Hope Scale. And then we statistically analyzed the reliability and validity estimates, that is the psychometric properties. This particular technique actually allows us to compare demographic characteristics like age. So it specifically allows us to determine if there is a bias in these measures, say for age or gender, et cetera. We also compared English and non-English language translations. And what we found is that, in fact, a 7-year-old can adequately fill out the instrument. So the scale works really well. There were no found biases as a result of this research. So we offer that you can use these scales, the Children's Hope Scale, with confidence. that it does, in fact, measure hope very well. So some of the things that the research shows us in terms of when youth score either in the low hope, slight hope, moderate hope, and high hope categories. So just to show you a few of the differences, in particular, we see that high hope youth actually tend to score better on indicators of well-being, emotional regulation, and adaptive coping. Whereas we tend to see higher rates of depression, anxiety, and maladaptive coping strategies in the lower hope categories. This will include an increase in risk-taking behaviors such as alcohol, tobacco, drugs, and sexual behavior among youth. Physical health, again, we see improved physical well-being indicators when compared to the lower hope scores. The social connectedness tends to be improved as we increase hope. Remember, as Marianne indicated in the introduction, that hope is a social gift. Hope is greatly enhanced through our ability to connect with others. Whereas when we see the lower levels of hope, an increase in loneliness, isolation, etc. And then finally, and I've already mentioned these, but we tend to see a child's hope scores are significant predictors of attendance, grade point averages, graduation rates, social emotional learning, and engagement in the classroom. Whereas we tend to see higher rates of difficulty in these education achievement indicators for the lower hope group. So that is basically the way in which we measure hope with youth. I use that scale very frequently in my research and when I evaluate programs. And just I wanted to share it with you. Number one, it's validated for youth 7 to 17. It is a scale that is available to the public. It won't cost you to use. So it is easily accessible as part of integrating that into your programs. So what I want to do now is transition in the last part of this conversation before opening up for question and answers, is to really start thinking about what does it mean to be hope-centered. So I think that the power of hope is the fact that it offers us this organizing principle for the way in which program services are provided in our communities, that our program services are in fact pathways of hope. So what does it mean to be hope-centered? And so from an organization or program specific, I begin to think about the idea that hope becomes a central component of the value of philosophically of what your organization does. We learned yesterday the distinction between achievement and avoidant goals, for instance. So one of the things that I would ask you is when we think about a hope-centered organization is to begin to consider your policies and procedures as through the lens of hope. That is, do policies and procedures, do they influence an achievement mindset? Or do they influence an avoidance mindset? And I'll give you a real simple example with an organization that I've worked with, in particular, drug courts. And drug courts tend to be very focused on an avoidant framework. That is, if you use drugs or alcohol, you go to prison. So all of the policies and procedures promote an avoidant framework. And so we begin to work with these organizations to really re-examine those practices. And remember that in this context of being hope-centered, hope is not the outcome. Hope is the process, and well-being is always the outcome. These indicators of well-being is really what hope is intended to promote. Now, I do measure hope. I do consider hope as part of that leading into those short-term outcomes, but it's really the fact that it promotes physical, psychological, and social well-being for children, adults, and families. One of the other things that we've seen with the organizations that have begun to adopt this hope-centered framework is that hope provides this common language across these diverse teams. And we tend to see that when we have a common language around goals, pathways, and willpower, that it tends to promote things like trust and communication and cohesion within an organization, as well as between program providers and the youth, for instance. So one of the things that I wanted to be able to highlight is what some of our research has found in terms of being focused from a very intentional perspective in promoting hope, both within the organization as well as to the youth that you serve. So for instance, we tend to see with on the far left-hand side, for youth, this would enhance goal attainment, emotional regulation, as well as just self-regulation, as well as their connectedness. We've also integrated this very much in how the organization provides support for employees, because we tend to see improved flourishing among staff. Transitioning to that at the organization level, we also have found repeatedly, we actually are just publishing a couple of pieces that show that hope is actually a protective factor against burnout and turnover in high stress environments. And then I've already talked about providing a common language. I also think about, for instance, the way that hope could influence social policy, as well as things like fundraising. So for those of you who actually engage in, say, fundraising with corporate foundations or family foundations or even individual donors, is to begin to really think about your donors as having very specific goals. Even the federal programs have very specific aims, goals that they are intending to pursue. And your organization is a pathway to those funders and helping them achieve those goals. So we tend to see a little bit improvement in development activities as well. Now, I usually provide these guiding principles as part of our deeper 4 and 12-hour training programs, but I thought it might be useful for you as you think about hope in the context of SRAE programming. And so I just wanted to share with you the guiding principles that we use to think about hope in the context of hope-centered organizations. So first and foremost, and by the way, I created these guiding principles so that they could be presented almost as a soundbite. That is, they're easier to remember. But what I would like for you to think about are how would you explain some of these guiding principles to your stakeholders, to your staff, to your coworkers, in terms of being able to explain the science and power of hope. And first and foremost, is to remember that hope is a mindset. Hope is a way of thinking. Hope is more than an emotion, so to speak. And the reason that this is so important is because if hope is truly a way of thinking, then we know we can teach it. Imagination is the instrument of hope. You might remember that this is where I used my granddaughter, 12-year-old granddaughter, as an example, going to college campuses, taking her picture in the library and the student union, etc. But what I'm really getting at is creating an opportunity to develop a vision of what that future could be, that aspirational image that we would have in our minds about the future that is possible for us. And it is creating that vision, creating that scenario of what life will be like through successful integration into your program. So creating that vision of the future becomes very important, very groundbreaking in nurturing hope. Remember that hope is not wishful thinking. When we use the word hope, like I hope you are well, hope you have a great day, hope there are no tornadoes, etc., that's really using hope in the context of a wish. And hope goes beyond wishing. A wish is when we have the desire for an outcome, but no pathways. And remember, hope is about taking action to pursue that future. When we have a wish, it is passive towards our ability to pursue that future. That's the important distinction. Hope begets hope. To me, this is one of the more critical things to integrate in this idea that developing those pathways, those benchmarks that we can really focus on that lead us towards the ultimate goal, that hope begets hope. And so one of the things that we do, I talked about this previously, we set the goal, and then we identify those measurable or those important benchmarks or steps that are going to lead to the goal. And so as an example of the way that I use this personally, when a student comes to me and they want to do a dissertation, for instance, the first thing that I ask that student is, when do they want to graduate? Because the best dissertations have finished one. And so if I know that you want to graduate in May of next year, then I know that by May 7th, you have to defend the dissertation. From May 7th, you have to have a 2-week window for your committee to have a reading paper. But my point is I can put very specific timelines and dates and very specific achievable objectives that have to be met so that when the student walks out of my office, they have a complete game plan that they're working towards. And that is the idea that hope begets hope. And then remember that hope is a social gift, that hope is something that happens in relationship. Hope is something that happens in our ability to be connected to others, as well as being connected to something that's greater than ourselves. We see this repeatedly in the science and the literature, is that mentoring programs, for instance, we've published on how mentoring programs become a very significant predictor of hope, especially among high trauma youth. So again, having those important adults in our lives as a protective factor for youth. And then finally, this idea that hope can be taught. Hope is something that can be shared. Hope is malleable. My work has specifically shown that we can move the needle for individuals, for youth who are experiencing apathy as well as despair. And remember, you don't have to go from low hope to high hope. You just have to move the needle, and it begins to predict significant positive outcomes in that child's life. So just a couple of quick strategies of things that you can do, and then I'll transition fairly quickly then so we can maybe spend a little bit of our final time together with some Q&A if you have some. But I think that these are some basic steps that can be used in creating a culture of hope. First and foremost is creating awareness of hope among stakeholders, which quite frankly is what we've been doing for the last 3 days during my part of the presentation. Is just to create an awareness of what is hope among your programs. And then the organizations, each and every one of you, have to make a determination as to whether or not hope is important. Is it a valued character strength? Is the science behind hope compelling enough that you would think this is the framework that helps us do the work that we intend to accomplish? I like to think about how we incorporate hope into staff meetings and into agendas, or into our intentional conversations with the youth that you're working with. So how do we very intentionally make that part of the ongoing conversation? So for instance, in a staff meeting, we may begin or end the meeting with a simple item of inviting people to discuss where they've seen hope this week in their work, and to begin to celebrate those successes, in particular in the Pathways journey. We also have to think about how do we onboard other individuals so that they become aware of the science and power of hope. And then ultimately, I'll just transition to this idea that while I've been doing research and practice around hope for 15 years, there is still so much to learn about how this process works. And so just this idea that we need continuing education and development as we learn new things about trauma and adversity, as we begin to learn new things about that is going to be greatly influenced by increased awareness of DEI, for instance. How does that influence the way in which we practice and understand hope? So this was just a more of a lecture style, I just realized, a little bit less in terms of questions. But I just wanted to sort of wrap up the science and power of hope, reminding us that hope can be measured, and that we can begin to think about very specific strategies that we can begin to incorporate hope into practice, as well as an organizational framework. So I think with that, I'll stop and see if there are any questions as we spend our final time together.
There's a question here, Dr. Hellman. You shared that an avoidant mindset can be positive. I think you shared that on the first day. It was very intriguing because you were talking about the achievement mindset. Can you elaborate on that in the context of sexual risk avoidance education?
Yeah, so I think the idea is, well, I'll answer it from the context of my work as well. You know, that when we know that there's this, you know, high rate of exposure to adversity, we know that, for instance, that youth across America tend to report lower levels of hope than we would want. And so we have to understand that we're really going to start from, or need to start from, a place of what outcomes are we trying to avoid? That is, what is the risk associated with sexual activities during our teenage years in terms of reduced graduation rates, increased exposure to sexually transmitted disease, sort of the generational effect that these kinds of things can have. So we might want to start from this idea of avoiding the possibilities of what life would look like in that context, begin to experience success as we provide those pathways to help youth make decisions so that they ultimately lead to this aspirational, idea. So at the avoidance level, what does imagination as the instrument of hope look like? And then at the aspirational level, what does that same imagination as the instrument of hope look like? So we really want to frame that imagination in the context of where the youth is in that moment.
Very good. Interesting. Okay, we have a question here from Lewis. I noticed that the topic surrounding hope is something that you are passionate about. With you being involved in it for so many years, what about the topic of hope initially grabbed your interest?
Yeah, so gosh, do we have a couple more hours that we could spend? Lewis, I really appreciate that question. I will tell you that when I literally that first time that I considered goals, pathways, and willpower, I immediately saw programs. I immediately saw that it was more than just the impact that it's had in my life personally. I saw that it was a way in which these important social programs like SRAE can begin to frame through a theoretical framework the work that you do, and that there's so much good science behind it that really begins to describe that work. That was the thing that hooked me right from the beginning.
I think you hooked a lot of us with that too. Okay, Vicki would like to know where she can learn more about how to host a Hope Camp that is interactive.
Yeah, so the Camp Hope model, I think somebody yesterday referred to it as well in the chat function from Northern California, probably maybe from the Shasta area, who knows. Camp Hope is in 25 states now. And so they are connected with the Family Justice Center model. So if you do have a Family Justice Center in your community, that would be one place that I would just look to see if they also have the affiliated Camp Hope model. However, we work with several other camping or youth like YMCA and others who also host summer programming. And it's really thinking about where to begin to integrate goal setting and pathways development into the conversation of the work that you, as I mentioned earlier, my guess is that many of you are already doing some of these things, but I think that this idea of hope as a framework allows us the opportunity to do it with intention. So the Hope Rising book actually provides a really deeper description of the Camp Hope model. But you can also go, if you Google Camp Hope America, you'll find more about the program as well.
Okay, and then we do have to wrap it up here in about 1 or 2 minutes. But Brendan would like to know, are there any specific habits that you do in your own life that you may share with kids to help them maintain staying connected to and choosing hope?
Yes. So Brendan, thank you for that. And one of the things that I do very intentionally is I try to start each day remembering that hope is not always a linear process, that some days are better than others. And that when I begin to get in a position where, like when COVID first hit, when the pandemic first hit, the fear and uncertainty of a situation leads us to that emotion-based coping, which really drives the avoidant framework. So I try to remember each day that hope is a cognitive process, that when I become emotionally engaged, I need to take a moment and stop to remember goals, pathways, and willpower. So that's kind of what I try to do very intentionally, but I'm also 15 years into it. So start small.
Excellent. All right, with that, please, if your question wasn't answered, bring it up in the field talk. That would be a great place for it to be discussed. So I will hand it back to you, Julie, Megan.
Thank you, Mary Ann. Thank you, Dr. Hellman. Please join us immediately following this session for Introduction to the Sexual Risk Cessation Model, Providing Second Chances for Hope and Health with Dr. Nancy Coppola. We will see you in just a minute or two. Thank you.